Good morning, everyone. Welcome and thank you for being part of WorkSafe's webinar, How the Building and Construction Industry is Dealing with COVID-19. Hello, my name is Rob Kelly. I'm the Director of Special Services in WorkSafe, and I'll be your host for the webinar today. Now, while our sessions are virtual this year, our aim remains the same for Health and Safety Month, and that is keeping you up to date. Our focus this year is navigating through COVID-19. We have three speakers today, guest speakers today, and I'd like to introduce them to you now. We have Fiona Nield, and Fiona is the Exec Director of the Victorian Housing Industry Association. The HIA is the official body in Australia for home building industry, representing and supporting residential builders, trade contractors, developers, design professionals, kitchen and bathroom specialists, manufacturers and suppliers. So a really good broad coverage there. We also have Paul Breslin, and Paul is the Health, Safety and Environmental Manager at Multiplex. He's also the Chair of the Victorian Construction Safety Alliance. They comprise of approximately 15 active members, companies that participate in industry programs to improve health and safety standards across the construction industry. And finally, we have Paul Williams. Paul is the Work Health and Safety Manager at Creation Homes and Chair of the Victorian Volume Home Building Safety Alliance. Again, a group established to help develop a positive safety culture within the domestic construction sector. Good morning to you all.
Morning, Rob.
Good morning, Rob. Thank you. Great to be here.
Thank you. So just to give you a bit of an overview, today the style is conversational. So myself and the three speakers will talk roughly about the outline how the Victorian building and construction sector has adapted to the new rules of COVID-19. We have allowed some time for questions at the end of this session today. Also remember, if there's anything that you need to urgently raise with WorkSafe, you can do so through the advisory line, which is on screen at the moment, or the emergency contact number as well. Now, before we get into it, we'll do a bit of housekeeping. First off, if you want to join the conversation today, you can do so by entering the hashtag #HealthHSmonth. And also remember, at the end of the session, any of the resources that were referred to today will appear on screen, so you'll have that information available to you. Again, welcome. To put a bit of context around this, about the building and construction industry, it's the second largest employer in the state. It accounts for roughly around 9% of GDP, so it's a sizable industry. To give you an understanding of the impacts, the stage 4 restrictions has seen large construction projects and projects that are above 3 stories had their workforce cut to 25% of pre-COVID levels. What that has also meant for those particular sites is you can only stay at that particular site for the work around the contractors, and you can't have blended or cross shifts. What you'll also find is with the COVID safe plans, they're required to ensure that they can demonstrate that they don't have cross or blended shifts, but also must have a contact tracing process in place. For smaller scale constructions, that has meant that sites can only have a maximum of 5 workers plus the supervisor at any one time. And in the case of trades, they can move across 3 different sites within that period. So the impact has been significant from that point of view, restrictions. And from large-scale government jobs, the workforce has been cut by half. So Fiona, I'm actually going to start with yourself. Given these rules that have been in place, what has been the effect on the industry at large?
Well, thanks, Rob. And look, the changes have been massive and really changed the way in which the sector has worked as the restrictions progressed, and it became increasingly important that as an industry and individuals that we demonstrated our capacity and commitment to operate in a safe and secure and healthy work environment during COVID. So we've obviously, as an industry organisation, urged our members to be vigilant and follow all of those requirements. We've worked to make sure that the industry is following all of the Commonwealth and state and territory government separation and distancing principles, and really to maintain a high level of hygiene on housing sites and make sure that trades are being scheduled appropriately and manage the building work in the best way that is possible.
Now, you spoke there at a very broad level. Now more about HIA members themselves. What's been the impact on your members?
Yeah, well, the first step at the start of the process, Rob, was to ensure that as an essential industry, that the domestic industry remained open and operational. So that was the first step to keeping going. But then it turned to very quickly to how to organise a new way of working in a COVID-safe manner. So we had to bring on board many thousands of our members and working in the industry in a very short space of time. And I must say, I haven't seen such a big change happen so quickly. And, you know, it's a really, big tick for our members who are able to adapt quite quickly. And of course, we're working with big builders, small builders, renovation companies, all kinds of different builders and people in the sector. Now, we had a dedicated web page, and that really has helped our members with a number of different resources. You can see, what it looks like there, and that's been put in place straight away, and it's also available to the broader industry. So the specific impacts that we've had to observe is probably working jobs at a much slower pace than usual. So we've had to limit the building site to essential workers only attending the site, adopting the 1.5 metre social distancing requirements, and also the 1 person per 4 square metres rule. That had to be put in place very quickly. And of course, I mentioned earlier about scheduling trades to make sure that we could maintain the 5 on a site and there wasn't crossover between them. And of course, building sites often have a lot of trades going to them for short periods of time. So making sure that those trades were scheduled appropriately, so the 5 on a site limit was never crossed, has been quite challenging for some members, but I must say they've done it pretty well. The other thing that we've had to do is make sure there's appropriate cleaning and site signage on site, and our making space on site guidelines, which I'll talk about in a moment, actually has helped with that, and members have put that up on their site very readily. Also inducting trades so they understand their obligations on the site, and we've got some tools that have helped our members with that too. One of the other big impacts has been on the renovations industry, which has been very hard hit. Many of them have been unable to work through stage 4, and that's been a constant challenge for them. And we're hoping to help them with a safe resumption in the coming weeks ahead to see them back on site and returning to work in that sector.
Thanks for that, Fiona. One of the things I really took from that is just the breadth of industry that's been impacted by this. And we'll get into it a little bit later on, but the impacts in many ways economically are important to understand here because of the run-on of impacts that can have in person. So can you give us a bit of even a quick response to the economic impacts this has had?
Oh, definitely. And I just mentioned about the renovation sector experiencing a great deal of hardship, but certainly many home building companies weren't able to access JobKeeper in the initial stages, so very hard financially for them. Also, new home sales were impacted quite strongly. We had 14% downturn in new home sales in August, and whilst that's been a better result in September, certainly the impact of not having traffic through display homes and being able to take on board new business has hit the sector fairly hard. So we will see less homes built next year than this year, but we're very hopeful that the home builder program will help to make some new sales and actually see some home buyers back in the market pretty soon.
Thanks for that one, Fiona. Paul Williams, I'm actually going to move to you now. Fiona's really gone through a whole range of actions, some quite complex, some having to turn around really, really quickly. From the point of view of the Victorian Volume Home Builders Safety Alliance, could you tell us a bit more about what that is and what your focus has been this year?
Yeah, thanks, Rob. The Victorian Volume Building Safety Alliance is made up of 12 active members, and we have 2 industry association representatives in Tony Lopez from the HIA and Sam Smith from the Master Builders. We're a support network that conducts advocacy, interprets government policy and legislation, and then we basically work out ways to implement that on site. So, Rob, this year, our focus has been obviously predominantly on COVID-19 and interpreting the plethora of directions that are released on what felt to be like on an hourly basis. So in addition, though, to this, the members have still been working on projects around silica, UV awareness and ladder safety. Okay.
And staying with you Paul, is with the Alliance, what's the perspective been for the last, say, 6 months?
Well, I guess at the start it'd be fair to say we went into total shock. Not only did we have to prepare our members for the new rules, especially around hygiene and safe practices and distancing, we faced the very real prospect, of infection, site closures, and the economic and employment consequences of that. And then COVID plans were enacted and then updated almost on a daily basis. Our practices were updated as soon as they were introduced, and then we all had to adapt very quickly. But I've got to give credit here where credit's due. Fiona and the team at HIA were initially the quickest to react to this, and they developed their signage along with their guidance that helped the volume builders to remain open. So that was great.
Thank you. And Paul Breslin, I'm going to draw you in now. A large part of the work that you do for your members is interpret the new rules and the physical distancing. Paul just mentioned there about it was changing in some cases on an hourly basis, and you heard Fiona talk about all of the work that was done. How did it evolve for you and your members?
More or less exactly the way that Paul's painted the picture. Things were changing on a daily basis. So basically what was current today was redundant tomorrow. So we were spending most of our time constantly reviewing guidelines being introduced by government, simplifying them, synthesizing them, and providing the information to all our site teams. It's fairly difficult, more so probably for the site teams. The Safety Alliance, we did meet on a monthly basis. So the Safety Alliance also has stakeholders, standee invitees, the master builders, the unions, and WorkSafe. We had to quickly move those meetings to a weekly basis, virtual, for a number of reasons: to try and digest information that was being provided, to share procedures, to share ideas on how we could comply with the guidelines that was being issued by the government back then on a daily basis. But probably what stood us in good stead was the fact that the Building Industry Working Group behind the scenes had been developing a set of guidelines for the construction industry to deal with coronavirus. So them guidelines are now at version 8. When we look back at March, there was nothing being provided by government in relation to COVID safe plans. So that document that was developed by the Building Industry Working Group basically became the template for the construction industry to meet government requirements.
Thanks for that, Paul. One of the themes I was picking up there was, the sharing of information, working together, adjusting as you needed to, but also, as you said, in the background, there was a building industry working group. So we've heard there from the Industry Association, the HIA, we've heard from large construction, we've heard from home builders. Paul Williams, I'll put this one to you. With all of that work that was going on, how did you work with WorkSafe through all of this?
Well, WorkSafe have an open invitation to sit on the volume builders regular meetings that we have, and they were great at keeping the group focused on the actual intent of the directions. They also acknowledged the pressure on our site supervisors and the difficulty in scheduling properly and meeting these new rules. So keeping the industry, though, active and running was key, and most importantly, we didn't want to exacerbate the spread of COVID-19. So WorkSafe, basically, they helped us and helped keep our members safe. So a bit of a shout out really to Kate Maharis and Anthony Cockrell from WorkSafe, who worked pretty hard to try and keep us informed.
Thanks for that one, Paul. Paul Breslin, I'll come to you. For those of us not in the industry, what are some of the new practices that you had to instill during this time?
Rob, it's fair to say that the industry probably changed dramatically towards the end of March, start of April, when we had the first positive test cases. So, as I said, industry had been developing the COVID safe plans, and maybe I'll just go to slide 1. Slide 1 basically illustrates some of the practices that were implemented over that period of time, right? So first and foremost, we encouraged people that could work from home to work from home. Those people who had any symptoms whatsoever, stay at home and get COVID tested. Social distancing, which is fairly difficult when you think about how construction workers work on a daily basis. Social distancing was enforced, 1.5 meters. There was a significant reduction in the number of occupants of hoists and lifts, which is fair to say had a significant impact on how we do business on high rises. So there was hand sanitizing bottles displayed just about on every floor level throughout the buildings. Meetings obviously went virtual. And that's just to name a few of the things. Eventually then we started to moving towards temperature testing and self-declaration forms. Self-declaration forms started off, we started off using hard copies. But if we look at multiplex alone, on a daily basis, we have 4,000 workers on our site. So to try and decipher the information being provided by construction workers through hard copies was very difficult. And you had a potential that while you were trying to review the document, you were going to end up with a positive case. So we quickly moved towards using a QR system. And when you had a potential case using the QR system, which is obviously electronic, within seconds of a worker completing that form, you had an email to say there is a concern in relation to the following response. So we were able to address issues very quickly using the electronic system. Maybe we just go to slide 2. So slide 2 sort of this illustrates basically the processes that's been implemented. And some people have made the comment that security on construction sites is over and above what you'd expect to see at an airport. You walk into sites in the morning and you've obviously the first thing, you've got your hand sanitizer, you've then got your daily declaration forms to complete. From there, you go into the temperature test room and you have your temperature test recorded. Like a lot of, at the start, it's fair to say, a lot of companies were using the handheld temperature test guns, but eventually, to ensure we didn't have workers congregating outside the sites, we moved towards the infrared scanners, which again has stood us in good stead. So maybe we just go to slide 3. So slide 3, this photograph was taken roughly 4 months ago, and I'll just quickly touch on how things have changed during the 4-month period. It's fair to say probably one of the most important procedures implemented by all stakeholders is the mapping and contact tracing procedures. And that's basically so we know where every worker hopefully is working on a daily basis. But just as importantly, we want to know where the worker is actually sitting in the site amenities during the meal breaks. So every worker was given a designated seat, designated table, which they had to use on a daily basis. So if you had a positive case, you were able to identify immediately who the worker was sitting beside during the meal breaks. What you probably noticed in this photograph as well is that 4 months ago, there was no mention about construction workers or society, people in society generally wearing masks. And we go to slide 4, we can see how things have changed. So slide 4, July 22nd, from memory, masks obviously became mandatory. And at that point, when face masks were introduced, bandanas and scarves were okay. And then a few weeks ago, obviously that changed. Probably what also helped, Rob, was the fact that we introduced, as Fiona rightly pointed out earlier, staggered starting times, and staggered meal breaks. And this obviously helped, especially in relation to hoist numbers, where you didn't have workers congregating waiting for the hoist at starting times and at meal breaks. So the practice that we introduced over the past six months have obviously prevented the spread of COVID. So just data released prior to the end of August, 0.04 construction workers contracted COVID in the past 6 months. And it's fair to say, when you think about the number of people who work in the construction industry on a daily basis, it's a pretty good record that we have up until now.
Thanks for that, Paul. And trying to get your head around, you know, a construction site you see that's so busy on a daily basis, to have those change in that period of time, and as you said, that result there is quite frankly amazing. That it's just quite frankly amazing. What struck me there, though, is under the OH&S Act, one of the key components is that an employer must provide and maintain a safe system of work. And what struck me there is that really goes to the heart of that requirement or that duty on an employer. What's your thoughts on that one, Paul Breslin?
I mean, I totally agree with the point. I mean, as a safety professional, it's all about looking after the health and well-being, and as an employer, because your workforce is the backbone of any organisation. and it's important to look after their health and well-being. And quite possibly there might be a discussion around the impact of mental health as we go through the discussion this morning. So it's fair to say that the focus definitely over the last 6 months has been to look after people's health and well-being. And obviously you don't lose focus to the fact that falling objects fall from heights, silica dust has an impact on the health and well-being of construction workers as well. But as an industry and as a society in general, we're dealing with something that some of us will never see again. And it's fair to say that some safety professionals can say we've become epidemiologists in a short period of time, digesting the information that's been provided to us all. So
thanks very much for that one. Fiona, I'm actually going to draw into yourself now. Building sites and construction sites, very busy places, lots of people coming and going. Can you help us understand what the HIA and your members, how they responded to these workplace restrictions?
Yeah, look, they are busy places. As I mentioned earlier, a lot of home building sites, they're frequented by trades who might visit that site for a short period of time and move on to the next site. So to start with, having to be constrained in the number of sites you can visit a week has been quite difficult. But I guess our response was pretty quick. As Paul Williams mentioned, we put in place some industry guidelines to help members manage all of these aspects on the work sites. And we recommended that copies were printed and placed on all the sites. And I must say that happened pretty quickly. We got it out there. We just realised that the industry needed help interpreting all of the government's requirements. They sometimes come through in very detailed documents and they can be difficult to interpret. So we got those site signs ready to go and we translated them into a number of different languages as well, which has been really positive and used on the sites too. So you can see on the slide there, the Making Space on Site guidelines, that's what they look like. And they just cover all aspects of the government's requirements. So social distancing, ensuring self-isolation rules and all of the 1.5 metre social distancing, all of those other aspects I mentioned earlier that need to be taken into consideration on sites, and also cleaning protocols and hygiene on site, which is really important. And I think that Paul touched on this too about safety equipment. So it talked on the use of PPE and the appropriate use of PPE and making sure that face masks are available and that trades have their own face masks and that they're wearing them. And finally, limiting the overlap and making sure that the scheduling of trades happens so that there's not too many people on site at any one time, and of course adhering to that 5-person on a site rule at all times. One of the other things we did do is implement a QR code, and we've got a slide which shows what the QR code looks like. Now, this is twofold. I suppose the first QR code was about induction on site so that trades could go through a simple procedure to understand what all of these obligations were on site. So if you didn't read the signage or if you didn't understand anything, you could look through this induction and actually understand what your obligations as a trade would be when you enter that site. And of course, the other QR code is part of our workplace mapping and contact tracing strategy, which really allows a builder to know which trade has visited their site on a given day. So you have a clear record of who was there, and if you needed to, you could get back in contact with them very easily should there be any need to do so. I might just add at this point that as a registered training organisation, HIA has transferred all of our training courses online, and that's been really significant so that we can continue with all those training processes that we run. We've run a number of webinars and events online and helping our members understand their obligations, and also all of our usual events and trade nights have been held online, including a mentoring series. And one of the other things we do also is we run a phone line so members can call into HIA with all of their queries around planning, technical, legal and OH&S queries, and we've been taking hundreds and hundreds of calls. Our team has done a really great job in helping members not only understand their obligations but also deal with the day-to-day technical and planning queries that still come into HIA. Even though we're in COVID-19, there are still some queries about other aspects of building as well. So our team's done a great job of helping the industry in conjunction with all of these tools that we've provided the industry to assist them with complying.
And Fiona, if I can come in there, an important point there is, the building and construction industry can be a challenging and a tough environment and industry. We've spoken about a lot of the COVID matters and touched on it a little bit earlier on. Mental health. What's the HIA done or your members done to support workers in the mental health space?
Yeah, so mental health's been something that we've pursued very strongly over a number of years. HIA, through its charitable foundation, has a partnership with Beyond Blue, and for quite some time we've been offering services through Beyond Blue through that partnership. It's a very important part of the work we do at HIA, and it comes right from the board down. It's a very strong theme running through. It's a tough industry, and no more than now do we need those services and that support for our members, many of whom are in hardship and will be for some time to come.
Thanks for that. So what I'm going to do now is I'm going to throw to our audience. This one ties in some ways. QR was one example, but Fiona, I'll actually stick with you on this one. How have you seen technology assist the construction sector during this pandemic?
Oh, look, it's been a huge help to our members. Many of the meetings that would normally be conducted face-to-face, such as walking through a display home, through a virtual tour, or conducting a meeting about a design aspect of a new home, contract signing, all of those things have been able to be conducted online. In particular, HIA Contracts Online does allow a DocuSign process to be implemented, so that all of the usual processes that would have been held face-to-face, we've managed to successfully transfer these to online platforms, and that's really helped builders keep the home building process ticking over, albeit a bit more slowly, but certainly those technology aspects have really helped builders to continue with the home purchase and home building processes.
Thanks for that one, Fiona. Paul Breslin, I'm going to go with this one and wondering if timeline to complete any project is delayed due to COVID, and what is the financial impact? Can you answer that one?
We can't talk about dollars and cents, so we can't, but it's fair to say that COVID has definitely had an impact on how we build. And as I pointed out, when you think high-rise buildings in particular, that you're constantly carrying workers up and down in hoists and internal lifts, and you've had to reduce the numbers in the hoist by roughly 70%. And the lifts, usually lifts carry 22 people, maximum now is 4 plus the driver. That has an impact. So it has. So the programs of buildings will definitely be extended. So
thank you. Paul Williams, I'm going to bring you back in on this one. Clarification on the numbers of workers permitted on site. What do you do if someone else is already there, but you have booked with a builder to be on site? Can you kick them off?
You would coordinate it. The supervisors on site would make sure that we haven't breached the numbers that have been put in place. So they would either stay out in the vehicles and they'd wait for the appropriate opportunity to go in. But it's all about scheduling. And unfortunately, it's a difficult task. I mean, the reality is you can't judge for traffic. You can't judge for all sorts of different things that are going to keep people on site. So you can schedule it as best you can, but you just have to manage it. Okay.
So again, that idea of communication becomes really, really important, and the coordination aspect of things.
One of the things we have found, Rob, too, and is that our industry, the domestic industry, is very well placed to manage some of the scheduling challenges. Mostly you will find that trades travel to site in their own vehicles, they have their own tools, and many of them work alone. So particularly at the start of the pandemic, that was the one thing that we did put forward to government, to say that the domestic industry is well placed in the way in which it works, because you've got all these trades working in either sole traders or perhaps with one or two others. They're travelling alone, they use their own tools, so they are well placed to actually comply with many of the COVID requirements anyway.
Just on that point, it's probably important to highlight the fact that the large-scale projects had to wind back the workforce to 25% for a significant period of time, over a 6-week period, right? Now, obviously, that has a massive impact on production. So it has. So, and at the moment, we're still operating at 85%. So we actually haven't gone back to 100% production yet.
Thank you. And Paul Williams, I'm going to draw you back in again. Do sole traders need a COVID-safe plan to operate?
Yes. Absolutely. Everyone who operates a business needs to have a plan in place. And look, there's There's lots of information, but you can go to WorkSafe's website, you can go to the DHHS website and get the information that you need. But you must have one in place.
And Paul Breslin, I'm going to draw you in on this one now. Is it possible coronavirus is spread through imported construction material that has been contaminated? I'm assuming it's been, the example here would be it's contaminated overseas.
Yeah, well, we haven't seen that as yet, but if you look at the case in New Zealand, obviously the virus is brought in on frozen food, frozen fruit. Is there a possibility? Possibly, but up until now we haven't seen that at all. So
one way of responding to that would be is, again, where the source is from, the trust in that source, getting advice from DHHS, or in some ways with the HIA as well, finding out, is it a trusted source or a trusted location? Is that a fair comment?
That's a fair comment, yeah, absolutely. Yeah.
Okay. This one's a bit of a long one, but we'll work our way through it. So our workers are struggling with wearing fitted masks on site, and it's only getting worse the hotter the weather is becoming. Is the risk of wearing the mask and the respiratory and mental health problems this creates greater than the risk of contracting or spreading COVID-19? There's a mix in there that there's a bit of medical aspects in that one, but Fiona, I'm going to ask you to respond to that one.
Well, I suppose as the weather warms up, that is going to be something that all workers will have to deal with. But certainly at HIA, we've prepared some information about wearing the appropriate mask for the appropriate task. So just realising that there are different types of masks for different tasks, and we've tried to help our members understand that so that they are utilising the appropriate PPE for the task that they're doing. But certainly we've also urged everybody to be vigilant and follow all the requirements and keep all the PPE up and utilise it appropriately.
Okay. Is it important to just, I suppose, in some ways distinguish the difference between what a mask is and what a respirator is? That a mask is a mask, a respirator can be a mask, but a mask can't be a respirator. Sounds a bit of a mouthful there, but it's important to understand the differences there.
Yeah, well, that probably might be one that Paul Williams might have some further insights into, and the different types of PPE, but certainly there are many different types, and it's just important to realise that wearing the right mask at the right time is the most important thing.
Yes, Fiona, I agree. Just the appropriate mask for the job is super important, and there are varying types. I think there are respirators that you can use when you're cutting materials that produce a lot of dust, and then you should have vacuums on the end of that. But the masks are specifically designed to keep the COVID-19 virus away from other people. So the reality is, it's a slog. It's constant vigilance and constant reinforcement that's required on site to help these guys realise that we want to keep our industry open, and the way to do that is to keep everyone safe. And
sticking on the point of mask here, one of the questions is, what are the rules around obtaining a mask exemption? Are there specific guidelines or procedures? I'm assuming one of the things is we go to DHHS and the Chief Health Officer's guidance on that one, but is there anything specific you guys can advise?
Well, it's actually written there in the guidelines that you can get a medical exemption, right? So there's wearing a mask for someone that wears glasses. Wearing a mask is painful, right? The ramifications of not wearing a mask far outweigh the fact that your glasses get steamed up, or if you're an asthmatic, the mask has an impact. So you sort of weigh up which is more important: protecting myself against the virus, the possibility of contracting the virus, or worrying about my glasses getting steamed up. I understand on a construction site, especially asphalt workers, concreters, and it'll get worse as has been rightly pointed out. It'll definitely get worse as the hot weather comes into play. It'll become more painful, but the guidelines are pretty detailed in the fact that if you're doing strenuous activity in the workplace, then you can, for a period of time, the mask can come down and then put the mask back on again.
Thank you. Thanks for that. This one is going towards contact tracing. So what is best practice for contact tracing within the building industry when the numbers on site are over 50 workers? So I'm assuming what the question there is about is just the volume and size. How do you do contact tracing? Paul Williams?
Yeah, so we have a sign-in process, which is QR-based. It's a digital process. In that step, the people are asked to identify in what areas of the site that they're working. So if it's a larger medium density type operation, we will have a detailed list of where the people are on site, and that's also supported by the digital site sign-in process. So the QR code and the technology has been absolutely paramount in this instance.
And I want to just come back around to mental health question, and this one's been specifically directed at yourself, Fiona. What is Beyond Blue doing in the wellbeing space versus mental health space?
Well, I think they're providing a range of services to people who require it through their, online and telephone services. I know that we are able to access their people through webinars and through Zoom meetings. There's a whole range of ways in which we can engage with Beyond Blue, and they're really terrific services, have helped many of our members tremendously. And I think it's important to remember that they've been in this game a long time, and they certainly have the experts to help us deal with issues. I know we've been engaging with them over many years, and at our trade nights, for example, that we have a regular session about mental health and how people can work through any issues that they're having in that regard.
And it kind of leads in some ways to the next question is, and I'll put this to yourself, Paul Breslin, when somebody has presented themselves at work with COVID symptoms and they don't want to leave site because they say it's not COVID related, how do you manage this?
Well, the response to the way is you've got to go and see your doctor. I mean, that's the response immediately. I mean, in days gone by, we hear what you're saying, but things have changed dramatically over the last 10 months. If someone's got any symptoms whatsoever, they have to leave site. That's the reality of it. They must leave site. They're putting not just themselves at risk, but they're putting potentially everyone in the workplace at risk, potentially.
And again, this one goes towards interaction. Fiona?
Yeah, I was just going to say that similarly for domestic sites, it's a fundamental part of our making space on site guidelines is that anyone displaying any symptoms, mustn't come to site and must be isolated and must be tested. And it's one of the main features of the guidelines. It's the most important thing. And I was just going to add on to Paul Williams' comments before that, the whole idea of the QR code is that a report can be provided to the builder very quickly as to who's been to that site on that day, and they can be traced very, very easily.
This one, again, is about closed spaces. So, Paul Williams, could you provide some good practices to meet COVID-safe principle, avoid interaction in close spaces?
Well, again, it's all about scheduling. And in a close space, we will avoid having multiple people. We will, certainly in our detached sites, we'll have one person operating at a time. Where there needs to be multiple, we'll have them working in different areas of the site. But certainly, it's about the communication of that information. We use a lot of the posters that WorkSafe and onHIA have provided in multiple languages. It's about having that awareness around site. It's an imperative thing. If you don't have it, people just tend to forget. But yeah, that's the posters have been tremendous, to be honest.
Our site induction QR code has been downloaded some 44,000 times. So, it's thousands and thousands of people logging on to get this information, and the response has just been fantastic.
Now, I'm going to sneak this last question in. It's going to be a really quick one. Paul Williams, again to yourself. In domestic construction, is there going to be any change in the high touch areas being cleaned twice daily and logged?
Well, that's a great question, and we're certainly looking at that, and we're proposing it. Some of the things that we've been asked to do are a little bit challenging, but look, the reality is we can only do what we can do, and we just keep applying ourselves to try and achieve the goals that have been set out.
Or could I just add that making sure that all of the requirements that are placed on industry are appropriate to the setting in which they're being placed. So I think we've established today that there are some significant differences between large scale and small scale construction. And I suppose from that perspective, looking for measures that are appropriate to each setting is important for the industry.
Thank you. So to Fiona, Paul and Paul, thank you very, very much for that. Some really informative stuff there. So thank you. Very important to understand that WorkSafe is working to ensure workers are kept safe, but also supported through what is some really, really tough times at the moment. And I think it's fair to say that the examples and experiences and the work that has been put in by members of the HIA or volume builders or large construction companies has really led to a really good response to working with the challenges of COVID. Because as I said at the start, this particular industry is a very large industry, an important industry for Victoria. But again, it's something I did say halfway through there was when you provide and maintain a safe working environment or safe systems of work, I think this is a great example of how you get really good outcomes. So with that, I'd just like to say thank you again to our 3 panel members. I do wish you well for the future and the challenges that do lie ahead for us. And as I mentioned, any of the contacts that were mentioned today will be available shortly on the screen. On behalf of myself, our 3 panel members and WorkSafe, I'd like to thank you very much for joining us today and tuning in. Thank you.